Hi guys, so today we are going to be working on our psoas muscle, and this muscle is part of our hip flexor muscles. So it can get particularly tight from sitting, running, any kind of activity that we've been doing during most of the day. So how we want to find this muscle is we are going to find our belly button and our ASIS, so our hip bone here. So this is where your belt would sit upon. So once you find these two areas, we're going to find the midpoint in between these two. So once you find that midpoint, you can use one hand or you can use two hands, whatever is more comfortable for you. We're going to come down into that area. So come down gradually, start softly, and then we're going to just gently press down. We also want to drop our legs to the side then, so to the opposite side of the trigger point, and this just gives us a better angle at getting into that psoas muscle. So what we're really looking for here is a referral pattern into the back or a slight referral pattern into the hip as well. So it will be tender, but we are looking for a referral pattern here. So we don't want to just be poking around lots of different places. So if you are moving, just move very, very slightly to the left or to the right or up or down, just to find that little bit of referral or trigger point. Once you've found it, you're just taking a deep breath and exhaling. And as you exhale, you can go a tiny bit deeper then as well. But for the most part, we want to maintain a constant pressure. As you feel that easing, brilliant, because you've started to release that trigger point. As it releases, then you come back to center, and then we're going to do the same on the opposite side. So if you are working on this area and it's very painful and there's no referral pattern and it's not releasing at all, completely stop. So don't keep doing the pressure point and don't keep finding it. And if you feel any pulsing under your fingers, move away from that area as well, because we don't want to be on the aorta artery there. So just be very gentle to start with, and then work a little bit deeper in with your pressure. Ideally, this is a best released by a practitioner, but just in the times that we're in at the moment, if you adhere to just the guidelines of what I have just said, it is perfectly okay to work on this area. So if you have any comments, or you can send me a direct message if you have any questions on this area, I am more than happy to help.